Hello, hi. My name is Barbara Merrill. I'm the Chief Executive Officer of ANCOR. That's our acronym. That stands for the American Network of Community Options and Resources. And I'm just really delighted to be asked to share ANCOR's COVID story with all of you. Let me tell you just a little bit about ANCOR to begin with. We were planning to have a huge celebration this year because this year marks our 50th anniversary. We were founded so long ago, 50 years ago, by a small group of providers who religiously attended the AAIDD meetings. Of course, I can't remember exactly what their acronym was back then, but you can be sure it had MR somewhere in it, the American Association of MR or something. And that group of providers got together and started talking about the need to form an association to take all of what they were learning, the research, that's been surfaced through the universities and clinicians and practitioners, and actually put that into practice, put that into the practical application of home and community based services. So that's how we got started 50 years ago. For the last 50 years, we have just grown steadily. Our mission is really straightforward. We are a trade association. We represent private providers of services for people with intellectual and developmental disabilities and autism. Our members provide, you name it, and that's what our members provide, from all manner of residential settings, from people living in people living in ICFs to waiver homes, small waiver homes, to supporting people in their own homes or with their own roommates. Our members also provide, the whole array of day services, from customized competitive employment to day programs, enabling folks to spend meaningful days in community, to a segment of facility-based programs. What really defines ANCOR membership is that folks self-select joining us, and they come to spend time with us and with their peers across the country so that they can learn how together we can advance the ability of providers to support people with intellectual and developmental disabilities to fully participate in their communities. That's our mission, plain and simple. We're in every state except the state of Hawaii. If you're listening to this and want to help us out on that, we'd love to talk to you. We represent over 1,600 providers of services, and that also includes 50, I think it's 55 state provider associations. Some of our members you'd recognize. They might be affiliated with Easter Seals or United Cerebral Palsy or the ARC of the US. But the vast majority of our members are, operate in just their own state. They're really well known in their own community, but maybe aren't affiliated with a national organization. Um, we represent the biggest providers in the country, and we represent really tiny little providers, with the vast majority of providers being somewhere in the middle. So, how has COVID impacted us? Let me share with you, that what we do is we represent providers on Capitol Hill and before the administration. We also put on two conferences a year, to showcase leading practice and enable folks to network with each other. We were all set to have our conference in April. We were excited about going to Miami. We were going to be kickstarting our 50th gala year with our big celebration in October, where we had reserved the National Archives. And they were going to put the ADA out on display for us. Obviously, all of that got canceled. We are postponing that party at the National Archives to 2021. But at the beginning of the year, we were looking at advancing our public policy agenda. We were looking to pass a whole suite of bills focused on strengthening the direct support workforce. We were really excited about passing a bill, advancing a bill called the Margie Isaiah Harris and Isaiah Baker bill, which was a bill that was brought to us by Shirley Walker in Pennsylvania, who had worked very closely with Margie. Margie was an extraordinary parent of Isaiah, and she was just, she was just one of those parents that has built the community services system that we have today. She was just a relentless advocate, and she was always advocating for the right of direct support professionals to be able to accompany and support their individuals in the hospital. But federal Medicaid law prevented that. So that's what this legislation that we were all excited about pushing did. It would permit, at a state's option, states to pay providers for direct support professionals to accompany folks in the hospital. That was our really big agenda item. We were looking also to have direct support professionals designated to receive their own standard occupational classification called a SOC by the Department of Labor, so that we could collect meaningful data, given the fact that these workers are extraordinarily important, and community integration doesn't happen without them. That was our plan. And then all of a sudden, along came the pandemic, and it upended everything. We immediately swung into action. I remember having a conversation with my phone is ringing, with the CDC back in the beginning of March. Some folks at the CDC who didn't understand um, our um, our services at all. They were just completely unaware of the vast array of home and community services supporting people with disabilities. We were hearing from our members that direct support professionals were being blocked from going to their work site in New York because they weren't considered essential workers. So we swung into action, advocating to the National Governors Association, the federal government, and providing our members with a toolkit that they needed to be effective at the state level to have DSPs deemed as essential workers. Hand in hand with that was the extraordinary lack of personal protective equipment. Thank goodness for all the extraordinary women predominantly who sewed cloth masks and got them to our members before before folks could get the type of really good PPE and masks. It was extraordinary with the complete shortages of PPE and the lack of recognition that our members, the direct support professionals, were already on the front lines of this pandemic. We were getting the word back from our members in New York about how strongly it was hitting, how many group homes were experiencing outbreaks, how many people were getting sick, both staff and people served. Congress started responding, and we were advocating incredibly hard. We have never had our members respond as strongly as they responded to all of our action alerts. We've had, over 40,000 folks send direct messages to members of Congress and to the administration advocating for increased funding so that providers could respond, so that providers could pay direct support professionals hazard wages, so that providers could afford the additional PPE. Fortunately, Congress responded and established an emergency fund, although it took months before the Department of Human Services the Federal Department of Human Services recognized that our members needed that funding. That funding rightly went to hospitals in the beginning, but frankly, we needed that funding at the same time as skilled nursing facilities got it. As a result, we launched the Forgotten Faces campaign. It was a very extensive social media campaign, letters to the editor campaign, action alert, and finally, come April, we were able to have our members qualify directly for relief through that fund. So, those are just some of the pieces. But, I mentioned at the beginning the Margie and Isaiah bill. Back in March, was it the very first or maybe the second? I guess it was the second COVID relief package that Congress passed. They included this bill. So, I mean, that's just absolutely huge. It got, in some ways, a little lost, in all of everything that was going on. But we were so delighted to be able to pass it. We passed it in partnership with NASDs and some other organizations, AADMD. Thank you so much for all the work that you've done. That is a bill that is just going to pay dividends, a law that's going to pay dividends for years to come. So then we get to where we are now. As I'm taping this message, we're on the eve of the first doses of the COVID vaccine being shipped out to states. And we have been working very closely with AADMD and with NASDs and with NADSP in advocating as loudly as we possibly can for people with intellectual and developmental disabilities and our direct support professionals to be prioritized in the first phase of the distribution of the vaccine. We are pulling out all of the stops. You name it, we're doing it. We've gotten some early good news that ICFs are included as a sub-priority group in the recommendations from the Federal Advisory Committee. But all of this is now going to the states, and it's going to be up to the governors in all of the states to decide who gets prioritized. So this work isn't over in any way, shape, or form. We are moving, right now, the pandemic is surging. It's resurging in many ways worse than it was in the spring, and certainly across the country in greater numbers. The economic fallout from the pandemic has been extraordinary, and state governments are going to be feeling it. So we are continuing to advocate very hard to Congress for additional relief to go directly to providers and for additional relief to go to states to help states so they are not put in the position of having to even think about cutting services for people with disabilities. So, Seth, I could go on for a long time. I think I've probably gone well over my 5 minutes, but this is
Thank you so much.
This is, there's just so much, and we need all the help that we can get. So thank you for the partnership. Thank you for everything AADMD is doing. We couldn't do it without you.